the Spinal Truth Show weekly podcast edition. I'm your host, Dr. Caleb Slater. This week we're here to talk about necks, which is why I am so excited to have Chris, because he's an average person with an average neck.
My neck is average?
Average, very average.
I watched 90 Day Fiancé, and there's a guy on there who has like no neck. Like his head just sits on top of his shoulders, no neck. I don't know if that's a condition, but it's something we're going to get into today, I'm sure.
The no neck 90 Day Fiancé? You know, I didn't have that planned.
I thought you were going to say Chris is here because he's a pain in my neck or something along those lines.
No.
Like go for the dad joke route.
No, average guy, average neck.
I actually do know a lot about necks because my dad had a bunch of fusions in his neck.
Yeah, and you know what, because we've talked a little bit about that, that'll be kind of a good to talk about his journey a little bit, because I think it's going to resonate with a lot of people out there who have had, unfortunately, a pretty similar journey.
I know he did one thing that you really like. He had an inversion table in his bedroom.
Love it. And how's his neck doing now?
Oh, he's not good.
Yeah.
Had many surgeries, many different treatments, and he still walks around with a cane and cannot turn his head.
Inversion table's 0 for 1.
Yep.
And again, there's so many treatments out there that they help in the moment. They feel good, but they are not helpful. And I think that's something that really needs to get across to a lot of people. Feel good, but not ultimately helpful. And I mean, it's inversion tables, it's massage, it's chiropractic, it's taping, it's laser, it's stretching. It's a whole bunch of the treatments that are offered. And same with neck, like neck pain, like traction. Traction's a great one, all right?
Yeah.
So if you had neck pain, you've probably, I don't know, you probably have like a 20% chance that you've gone into some form of a traction table or somebody's pulled on your neck. So traction or decompression. When chiropractors, they tend to use the word decompression. Physical therapists will use the word traction. But
so that where they like lay you down and they crack your neck kind of thing?
No,
or?
so that's manipulation. So traction table, it's either pneumatic or mechanical traction. So like they'll put you in a little thing and they put a harness on you, and sometimes they'll actually even cinch down your waist so you can't move.
Yeah.
And then they pump up, if it's pneumatic, they pump up the traction so it's pulling your neck apart. Or if it's mechanical, they put a certain amount of poundage into the machine, and the machine gradually pulls your neck apart.
Which, as a layman, that actually sounds like it makes a lot of sense, because when you have neck pain or any kind of sensation like that, you feel like it's kind of like a grinding, or there's just pressure pushing down. And so the idea of, if we just give space, then all that pain will go away. So it makes sense.
It makes a ton of sense.
Not knowing anything.
Well, no, I mean, it makes a ton of sense. And hopefully I say this a lot, but all of these treatments that I am now, let's just say, shitting on, right?
All over, yeah.
All over. I have tried all of these in my career, not only for my patients, but also for myself. Like, I wanted to see what it felt like. I've had neck and shoulder pain, so I wanted to get better, right?
Yeah.
I wanted my patients to get better. And so specifically, back to traction, I've done pneumatic traction, mechanical traction, and mechanical traction, there's intermittent and constant. I've done traction where you pull on the patient's head, in different angles, like it's clinician traction, right? It does sound, theoretically, that it would be relieving. And it is. It is relieving. You do open up space. You do take some pressure off of the joints. But the problem is that eventually,
as soon as you get up off that
you
table
let
and start
go.
doing your life again.
Exactly.
Yeah.
Eventually you sit back up. Eventually somebody stops pulling on your neck. The machine stops pulling on your neck. And now you're right back to where you were. And there's actually something called a traction reaction too. That it's not too common, but I'd say it happens maybe 5% of the time, where you're actually in more pain afterwards for certain reasons. So the point is that traction feels good, but it doesn't make you better.
Right.
Just like a lot of these other treatments out there. And to kind of illustrate that point, if it worked, and I say this about the inversion table too, right? Like if it worked, you'd be better by now.
Yeah, you wouldn't keep going to the chiropractor every week.
And this would be standard care too, right? If you had neck pain and I had neck pain, any PT or chiropractor or physiatrist that you'd go to, they would give you traction because it just works for neck pain.
Yeah. I understand with neck pain, I think it's a bit different than, say, like a foot pain or maybe even a wrist pain, because there's so many activities where you would feel the pain, right? Like
I mean, pretty much everything.
So just any sort of temporary relief is a godsend to some people.
And neck pain is very often coupled with either headaches, which is probably the number one, shoulder pain, dizziness, and facial pain, typically the jaw. So like if you have chronic neck pain, you probably have one or maybe all four of those accompanying symptoms. So it's not just it's your neck that's limiting you most of the time. There's normally something else, you're getting headaches, you're getting some dizziness. If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
And I've had times where I've woken up from, I don't know, maybe laying in a certain position, and it's like, I can't even move my freaking neck.
Yeah.
And I don't know what that is. I assume it's some sort of, I thought muscular situation, but maybe it's structural, I don't know.
Yeah, I mean, muscles tend not to react poorly to rest.
Gotcha. Yeah,
right?
yeah.
I mean,
so,
right?
Yeah.
I mean, that's,
yeah, I think so.
and again, kind of like making this simple. So all of the treatment out there that's offered, in my opinion, for the most part, it's poor or it's lacking. And if it's not traction, which isn't too common, like, again, maybe 20% of the time you'll get offered traction. And there's home traction units too, like over the door. There's like accordion looking things that you put on your neck and you pump them up at home when you're sitting. But if it's not traction, the first thing that you get treated with, what do you think? Let's say I have neck pain, I go to any physical therapist. What are they going to tell you to do?
I want to say it's probably like injections or something.
Well,
like
they
that,
don't do injections.
Okay, then I don't know actually.
Stretching.
Just stretching your neck.
Just stretching. And it's the same 3 stretches.
Okay.
It's this stretch, it's this stretch, it's this stretch.
So I went to a chiropractor before a long time ago, and the one he would tell me to do is I put my head down like this,
there you go.
and then also I'd reach behind my back with my other arm and pull my arm down.
Perfect.
Because you do feel like this
feel
whole,
a really good stretch.
yeah,
right?
muscular stretch.
Yeah.
Like, oh yeah, just do that and I'm fine.
Yeah, but again, that's lacking. And why is that lacking? It's because at the end of the day, you typically don't have that much more range of motion. Like you've only stretched the muscle, fascia, ligaments, but you haven't mobilized the joint, and you're not stronger in that range. So our body, it's a lot simpler than we've made it out to be. Like it needs mobility and it needs strength in those ranges.
Yeah.
And also too, stretching isn't what treats muscles. Muscle contractions is what treats muscles. Stretching, most of the time those muscles, they're like, you hear tight and it sounds right too. If they're tight, you stretch them, right?
Yeah.
But they're often tight because they've either been underused or they've spasmed, and the way to get them out of that, and they've actually changed their tissue makeup over time. They form little blood bundles. They
Neovascular.
Neovascularization.
I know all the
that.
words.
You love that term. They've maybe even calcified a little bit.
Yeah.
They've thickened. So they've changed their tissue. They're not as strong. They're not as pliable.
But then why? What is the purpose of stretching then?
Feels good.
So, but why do you need to stretch before you go for a run or stretch before you do some workout?
Well, they're actually changing that a little bit. So
Okay.
you've seen a lot of change to more of like a dynamic warm-up, where you're actually doing movements and getting blood flow.
Like a walk before going into a jog.
Pretty much.
Or something like that.
Yeah, something like that. Doing some maybe activity specific, like some squats, some like light air squats, light air lunging, high knees, butt kicks, stuff like that.
Yeah.
Like those warm-ups before, rather than just static stretching. Static stretching has its place, but it's really only for like if you're if you're an elite athlete that you need to really get that end range of motion, or if you've really trained a specific body part. Let's say you went and you did leg day, and you really worked your quads. Stretching your quads a little bit afterwards is good.
Yeah, I've done a bunch of yoga videos at the end of the day, and what they tend to do is they just relax me because they do. It's like a full body kind of stretching all of it.
And it's, again, it feels good.
Yeah, it feels good.
Right? It has its place, but if you're injured, stretching isn't going to get you better.
What about, I've seen people who they wear the neck braces, but they don't even have a fracture or anything. Like it's just
Yeah, so that's definitely a lot less common these days. So, but it's still fairly common for the back, which is annoying.
well, my dad used to wear one often.
And how's he doing?
Terrible.
Yeah. So, this maybe isn't a great analogy or like a one-to-one, but you know those tribes that would like put rings around their neck and then like gradually add to
Stretching
them, but they could never take those rings off because their neck wouldn't support itself.
Because their neck has been bypassed, the muscles have been bypassed.
Yeah, so there's actually a guy on the internet, I think it's Backstrom, I forget, but he says be your own brace. And he's right. Like your neck, the musculature, it's made to support you.
Yeah.
Right? So yes, you're in pain and there's a reason for you're being in pain and you need to figure out why that is, but the brace isn't the solution. The brace will, if you wear it too long, it'll ultimately lead to your weaker natural brace, your weaker musculature, your neck not supported as much.
Yeah, because you're not using those muscles.
Because you're not using those muscles, or you're also not using those joints in end ranges, right? You can't look down, you can't look up. Rotation's still a little hampered, right?
Yeah.
So now you're not moving your neck, so your joints stiffen up, your muscles, tendons, ligaments stiffen up, fascia stiffens up.
It makes sense, but it kind of sucks because if you put something like that on and it alleviates your pain, it's like, oh, this is the easiest solution.
Well, and I've said that too. Like, look, if I'm in pain, I want to feel good right fucking now, right? Like, I want to get better. I want to feel better right away.
Yeah.
There's nothing wrong with that. There's nothing wrong with taking a pill, taking an injection, putting a brace on to feel better.
Knowing that it's temporary relief,
But so that's the issue. So you need to know that, number one, it's not treating the underlying cause. None of what I just said treats the underlying cause, right? Number two, you need to also be doing something that will lead to lasting relief and treatment of the underlying cause. If that's the case, I'm absolutely not against feeling better in the moment, right? Like you need that.
Yeah.
I need to go pick up my kids or make dinner, or maybe not make dinner.
No, you're not going to do that.
Yeah, I'm not going to make dinner. But like
I make dinner.
Kill a spider around the house, you know? Like
I got in trouble last night because there was a spider in the bathroom, and Steph goes, "Get the spider," and I said, "I don't want to touch the spider." And then she was like, "Fine, I'll have to do it." And I was like, "Fine, I'll go get a glass." And then it ran away, and she yelled at me.
I don't. My general rule is I don't kill it unless it's a threat.
I don't kill it either, but I really don't like spiders. I don't think just because I'm a guy I have to like spiders or something. She likes spiders.
Yeah, I mean, I don't like spiders. No. And I have no problem killing them other than if I don't need to kill something, I don't want to kill something.
Right. But, so then the true treatment for necks.
Spiders?
No, your neck. We're talking about necks.
I mean, true treatment is spiders.
It's spiders. I was going to say, it's just having your neck removed like the guy on 90 Day Fiancé.
Exactly.
No, but essentially that's what my dad kind of did.
Well, he ended up having fusions, right?
Fusions, where it's like he has no mobility.
And he had to keep having more fusions, right? Which is normal. Like within about 3 to 5 years, I think the likelihood of having another fusion after a fusion is somewhere around 50, 60%.
And I want to say that's what he did for like a decade or two, maybe.
And again, it should sound simple, right? The treatment. Why if you go to any PT, you're going to get a different opinion. Some of them are going to stretch, some of them are going to mobilize, some of them are going to strengthen, some of them are going to do neuromuscular control, some of them are going to do traction, some of them massage, some trigger points, some of them are going to do taping, some of them are going to put you in a postural brace, some of them are going to strengthen or mobilize your shoulders. Like, why is there so much variance? It's because we're not getting the right treatment. The simple answer is get your spine moving and get the muscles contracting in those ranges. It's simple.
Do you think it's a matter of some things work for some people and it's therefore not an invalid treatment?
Obviously there are exceptions. Obviously there is variance among the population. But for a large majority of the people, you need mobility and then you need strength in that range.
Yeah.
Right? I mean, why not start there first?
Yeah. The reason I said that is because if I go to 5 different PTs, it's not like my treatment history generally comes along with me.
No.
So it's me relaying what they did, and half the time I don't even know, like, because I'm an idiot. You know what I mean? Like, I don't live that world.
I can't tell you how many people I've treated that had a surgery and they couldn't tell tell me what the doctor did. And I'm like, was it a fusion? And they're like, I don't know.
Yeah.
What level was it? I
don't know. Yeah, yeah.
Huh.
It's just like the blind faith, blind trust that they know what they're doing and this is going to fix it.
And I get why we have come to the like do an injection, do medication, do trigger point, do massage, do stretching. Like I get that because we want the quick fix. We want something that feels good right away. But at the end of the day, it just doesn't work. And the more that I got away from the gimmicks, right? The more that I said, I'm just going to kind of anything that isn't working and not leading to long-term recovery, I'm just going to basically get rid of, and I'm going to double down on the literal core, the foundation, your spine, and then strengthening around that area in those ranges. The better I was able to get people, the quicker.
I mean, but we know this. We know this because we see it in so many things. If you can go and watch an infomercial for a device that you go like this, a shake weight or whatever, and it's going to get you toned.
Well,
or you can go to a gym.
A home TENS unit. Yeah. So now they have home like ice. It's an icy hot patch that also has like a TENS unit in it. I think it was Shaq was the one that was selling it or the spokesperson.
That is such a big dude. How much voltage does he need to even feel anything?
Apparently he's very sensitive to voltage.
Oh, okay, fair enough. But it's the easy way out, right? Like you want something that quick and easy and works.
So and now we're seeing that like blue looks like a tidal wave, where you lay down, you put your neck on it.
Oh, that thing we saw on TikTok the other day?
Yeah, I've seen a whole bunch of that. And again, feels good, helps relieve your symptoms, doesn't help fix your problem.
But if you are, and I'm not saying that this is how every physical therapist or doctor works, but if you go into the doctor's office and they do something and you come out feeling a little bit better, then you feel like it's working or you feel like something worked, right?
Well, so I looked it up before this podcast. At any moment, 30 to 50% of the U.S. population has neck pain. In any year, in any year. 30 to 50%. 10 to 30% have chronic neck pain. So whatever they're doing to make you feel a little bit better in the moment isn't working.
Yeah.
And so maybe talking about a few of the specific diagnoses, because you were saying like, all right, what if you're different? What if you have this? What if you have this? So the primary ones are going to be a herniated disc and then spinal stenosis. Those are going to be the two. People need to know this information as well. You are about 50% likely to have a herniated disc, degenerative disc disease, or spinal stenosis on an imaging, on any, see it on an X-ray or an MRI, without any symptoms whatsoever. So what happens is when you go to the doctor and you have neck pain, they do an image, they do an X-ray, they do an MRI, whatever they find on that X-ray. I have a little bit of stenosis, I have some bone spurring, I have some facet arthrosis.
Sure.
Ligamentum flavum hypertrophy. Have you
my God.
Have you had that?
So much.
Whatever they find on these images, they're going to say, this is your problem.
Yeah.
And then they're going to start treating it based off of these images. So imaging is much more misleading and inaccurate than most people realize. And I say this a lot. And hopefully this eventually gets out there. Remember, it's already kind of an inaccurate depiction of you yourself. You're lying down for the most part.
Yeah.
You're in a neutral position. So there's no weight. You're not turning, you might not even be in pain. So whatever is being pressed on or pushed on or pulled on isn't paining at that moment. So it's already not giving you an accurate picture of what's going on.
Right.
Additionally, we have these changes that occur naturally throughout our lives. And again, a whole bunch of studies that show this. By the time you hit 50, you are about 80 to 90% likely to have something. Some form of degenerative changes, degenerative disc disease, herniations, spinal stenosis, blah, 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 right? And nobody tells you this. No doctor says, look, this is a common, finding. Yeah. Let's correlate your symptoms, And I see this a lot, especially with low back pain. I see a lot of people with low back pain, and they're also having like hip, groin, and knee pain, and they're getting told that it's their L5-S1 issue, L4, L5, L5-S1. And I actually have a patient right now. And he was told that he needed a fusion, but he's having his main symptoms are hip and groin pain. The hip and groin is innervated by higher up. So like they're not correlating the findings on the imaging to the patient's symptoms. This guy was about to have a fusion, and he's young, he's younger than me, and it wasn't going to fix his underlying problem.
He's definitely young. So what was a neck problem then, essentially?
For him, it was lower back.
But the treatment area would have been where?
A little bit higher in the spine.
Gotcha.
So they were going to fuse L4, L5, S1. None of those levels had anything to do with his hip and groin.
So it wouldn't really have changed anything.
Wouldn't have changed at all. But except he would have had a fusion. If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
Which that would have forever changed.
That would have forever changed. And you see this in the neck too. So you see this where, and another thing is that, all right, these findings can be present without symptoms. Mm-hmm. The other thing that you need to know is that you can rehab your neck if you have a disc bulge, if you have a herniation, if you have stenosis. Like you can actually work to the point where you might still have some stenosis. You might still have a little bit of a bulge, but you are now asymptomatic. Right? And if I told you have a disc bulge right now in your neck, but you have no problems whatsoever, you do your yoga, you do your work, anything that you do in your life, you don't have any problems, you don't have any symptoms, are you going to get a surgery?
No.
Right. Why would you?
Yeah. My dad, I think he had a bunch of herniated discs, I want to say.
Probably.
He worked on an assembly line for Mack trucks, and I remember he would tell me he'd have to bend down all day and drill things or something, looking up like this all day.
Yeah.
Which obviously seemed to lead to a lot of back problems.
Yeah, I mean it could. Honestly, we're so forward flexed these days that now having something to do to look up once in a while is probably a benefit.
Yeah.
Anything that you do over and over and over again can lead to a problem.
Yeah.
But again, we've made things too complicated. If you look down too much, guess what most of the treatment should be focusing on? Looking up and mobilizing your spine in that direction and strengthening your muscles in that direction.
So if you have major neck pain, all is not lost.
No, and it's actually fairly easy to treat. I'd say for most neck symptoms, within 3, maybe 4 sessions, I expect 50% improvement or more. And these are for people with chronic neck pain. I never get somebody that slept wrong and kinked their neck. You know what I mean? I get people that they're all right, it's been almost a decade. I've seen all these other people. They've probably had some, injections. They've done medications. They maybe even had nerve ablations, some higher level, more aggressive treatment, and they're contemplating surgery. Those are the patients that I get. And I still expect about 50% improvement within 3 to 4 sessions.
Yeah.
Okay, and that's a session a week. So, over 3 to 4 weeks. And we work on strengthening the muscles through a range, and I show them how to mobilize their own spine into the range that it needs to. And maybe this is a good final point here. The area that is largely overlooked for the neck is what the neck sits on. Your upper back, your thoracic spine, the area between your shoulder blades. Again, we're basically a sedentary society, right? Mm-hmm. We sit to read, we sit to do computer work, we sit to drive, we sit to mess around on our phones. If we lay down, if we're reading, we have 2 pillows behind us or more, so we're still in that flex position, right? If my thoracic spine is stuck into flexion, if my thoracic spine is weakened, and I can't really sit up well, my neck is in a position that it will not recover from. So it's kind of like the foundation, right? If you want to build walls, make sure your foundation is secure first. Same thing. So most of the time people go into treating the neck without first fixing the foundation. And that's something maybe a little bit more unique that I do, that I spend the first visit, maybe 2, working on that foundation before we get to the actual neck. And you'll feel a little bit better, during that time. We're definitely addressing your symptoms. But I'm setting us up for success.
Yeah. So if you've had fusions in your neck or in your spine, can you still get a treatment that potentially could help you?
Yeah, you absolutely can. You know, it depends on how many fusions you've had. And
Okay.
in any fusion, you have to, you can stabilize, strengthen the muscles around the area. And again, we're talking still through movement. So a lot of the strengthening techniques out there are core neutral strengthening. Like they'll literally have you put your hand on the side of your face and look to, and I've done this, right? I've done this and I've done this a lot. And like look to your left, even with your eyes, but without moving your head. So I'm resisting my head movement. And then same thing with like looking down and same thing with like looking backwards, right? Like I'm doing isometric resistance for movement. That's not gonna do anything.
Yeah, it seems kind of dumb.
It seems kind of
like
dumb,
that
right?
hand crawling thing. Where it was
But
like,
I guarantee you there's people out there at physical therapy right now doing this. And trying and again, I've done it. So like I'm trashing it, but I've done it.
Yeah.
I've done it probably for years, right? So you can strengthen for a fusion, but you still have to strengthen through range, and that doesn't happen. And then in any fusion, you need to work the levels above and below, because obviously that level is fused. So if you want to get mobility, you have to work above and below. And often for cervical fusions, working the thoracic spine is a great answer.
Some of the other things that I've seen people do, hot pack, cold packs on their neck and stuff like that.
Yeah.
Is that even going to provide
So
temporary relief?
a hot pack, it's been a while since I've had my modalities class, but a hot pack is supposed to penetrate to the depth of, I think, of about 2.5 centimeters.
Yeah, that definitely.
Right? Somewhere around there.
Yeah, somewhere.
1 to 2.5 centimeters. The whole point of a hot pack is to bring blood flow to the area.
Okay.
Right? Blood flow is how we heal, right? And you know, blood flow makes you more pliable. Guess what brings blood flow better and makes your tissue more pliable better?
Moving.
Muscle contraction,
Yeah.
right? We talked a little bit about this. Like in an ice pack, for the most time, if you're chronic, right? And chronic is, if you want to say like absolutely chronic, you've had your symptoms more than 60 days, right?
Yeah.
For most people, more than 30 days. You're no longer swollen, red, bruised, you know, whatever. Ice is actually probably more useless or even a little detrimental. Again, blood flow is how we heal. Ice is a vasoconstrictor. It gets blood flow out of the area. So like it might feel good in the moment, but it's not leading, even ice pack or hot pack, any of that's not leading to relief. And we talked about this a little bit. They went through a long time where they were putting people that had a total knee or an ACL repair, and they put them in what's called a CPM machine, continuous passive motion. And it sounded great.
Yeah.
And I was all in too, right? You would put your leg in it, you'd wake up with your leg in it from surgery. It would be moving your knee back and forth to keep your leg mobile, right? Yeah. So it wouldn't stiffen up, and it was also supposed to combat blood clots. So it was supposed to promote range of motion, decrease pain, promote healing, and decrease blood clots. It pretty much did none of that. And you know what blew it out of the water?
Just walking.
Walking.
Is it because you're not actually engaging any of the muscles?
Correct.
Like it's just doing the work for you?
So continuous passive motion. Passive.
Yeah.
And that's what most of these treatments out there too. That's what traction is for the neck. It's passive. That's what somebody stretching your neck. That's even you stretching your neck is still kind of passive. Yeah. That's what hot pack, ultrasound, massage, TENS, laser, taping. That's even somebody cracking your neck. It's all passive, right? Passive treatments, somebody massaging you, somebody doing trigger point, they're not as good as muscle contraction. We made this too hard. We kept searching for the path of least resistance to the point where we got off the main path in the first place.
Yeah, the waters got muddied, and now obviously everybody wants the easiest, quickest solution.
And you want a pill, you want a supplement. I'm drinking Lion's Mane coffee right now.
I'm drinking bourbon.
You probably
I have no pain. I have no pain anymore. Yeah,
so I'm trying this, and the point is like I'm still buying into some of these gimmicks or fads or supplements or stuff like that, and so I get why people out there are. But for my patients at least, I've gotten away from that, and I've never gotten my patients better than I have recently.
All hope is not lost if you got neck pain.
Yeah, and very treatable.
Yep.
Unfortunately, it's poorly managed in the medical system. Probably what your dad went through is exactly what everybody else went through. Had some neck pain, they did some imaging. Imaging said this. They tried an injection, didn't work. They tried some medication. Medication eventually needed to be upped and or changed.
And now it's,
And then they went to different medications. So initially it was for pain, then it was for muscle relaxers, then it was eventually for nerve pain. So like Neurontin, gabapentin, stuff like that. That ended up not working. So then they did probably like a microdiscectomy, laminectomy at first, and that helped for a little while, but then his neck pain came back, so they said, well, there's nothing really more to do other than a fusion, so they did a fusion. Then after the fusion, things weren't working, so they decided to do maybe a nerve ablation or another fusion after failing to up his pain medication for a while. So they ended up doing another fusion, and then they did a nerve ablation, and that's not working, and then ultimately they either try some dorsal column stimulator, so it's an implanted pain stimulator that ends up failing, or they just try to put you on lifelong pain medication, and eventually they say that you're like a pain pill seeker, right? And they try to discharge you from their care and you have to go somewhere else. How'd I do?
Yeah, he's on the lifelong pain, the hardcore oxy and all that stuff.
Yeah.
For the last
I don't know
years, probably.
I don't know any of the procedures your dad had, other than you said he had a fusion during this.
All that sounds probably pretty accurate. I don't remember all the specifics, but it was surgery after surgery after surgery over a decade or two.
Yeah. And hopefully somebody out there hears this and they're like, yeah, that was me, or better yet,
before they get the surgery.
Better yet, I'm able to point out what their future looks like, and let's see if we can fix this.
Yep.
All right. So that's our show for today, talking about neck pain. Hopefully we answered some of your questions. If you have any other questions, you can reach out to us at info@thespinaltruth.com. We're on TikTok, Instagram, Facebook, YouTube, Spotify, Lemonade. We're on some lemonade. We don't like lemonade. No, all right. Maybe we do like lemonade. Anyway, reach out to us. If you have something that you want to hear about, send it to us. Happy to discuss. If you want treatment, you can go to thespinaltruth.com. You can schedule a consult or a session with me. Let's get you better, and stay tuned for next week.